After age 60, a man's prostate becomes one of the most important and most vulnerable organs in his body. And yet, most men don't think about it until problems start. Difficulty urinating, waking up 2, 3, even 5 times a night, discomfort, or worse, a sudden diagnosis. Here's the reality every man over 60 deserves to know. 13.7% of men aged 60-79 will develop prostate cancer. 6 in 10 prostate cancer cases occur in men 65 or older. 65% of all new prostate cancers happen after age 65. Those numbers are real. But so is this. Lifestyle changes, especially after age 60, can slash the risk of aggressive prostate cancer by 30 to 50%. Today, you are going to learn the most complete, science-backed prostate prevention plan available, based on studies from Harvard Medical School, Mayo Clinic, the American Urological Association, and major peer-reviewed journals. This video covers diets that cut risk almost in half, exercise routines that protect your prostate like medicine, supplements backed by real science, not marketing, lifestyle habits every man over 60 should follow, age-specific screening guidelines, and powerful statistics men over 60 rarely hear. This information could genuinely change your life. Let's begin. 1. Understanding the prostate after 60. The prostate is a walnut-sized gland that sits just below the bladder, and for most of your life, it stays quiet. But once men pass 50, and especially once they hit 60, the gland undergoes shifts driven by hormonal changes, inflammation, aging stem cells, reduced cell turnover, and increased oxidative stress. That means you become more vulnerable to BPH, enlarged prostate. Over 70% of men in their 60s already have some enlargement. Prostatitis, inflammation, often triggered by stress, diet, or low-grade bacterial imbalance. Prostate cancer, especially aggressive types. Risk peaks between ages 60 and 80. But here's a key point the media rarely mentions. Most aggressive prostate cancers are influenced by inflammation, metabolism, lifestyle, and nutrition, not just age. This means men over 60 are not powerless. In fact, they have more control than ever. 2. Exercise, the most powerful protection. If there is one thing that reduces prostate cancer risk more than anything else, it is exercise. Not supplements, not medication. Exercise. The research is stunning. Vigorous exercise reduces advanced prostate cancer by 30%. This includes brisk walking, cycling, swimming, rowing, or uphill walking. It reduces the chance of dying from prostate cancer by 25%. A 2024 Swedish study found fitness reduced risk by 35–50%. That's not small. That's massive. But why does exercise matter so much? Because it reduces visceral fat. Visceral fat increases inflammation and drives tumor growth. It balances testosterone and estrogen. Hormonal imbalance is a known risk factor. It improves insulin sensitivity. High insulin and diabetes increase prostate risk. It boosts immune surveillance. Your body is better at destroying abnormal cells. The ideal prostate exercise routine for men over 60. A. Cardio, 3–4 times per week, 25–35 minutes. Choose any of these. Brisk walking with hills, cycling, swimming, light jogging, rowing machine. The goal is steady discomfort without strain, enough to sweat and breathe deeper. Be strength training 2 times per week. Focus on legs, squats, leg press. Back rows. Chest push-ups or chest press. Shoulders, light dumbbells. Core stability. Stronger muscles equals lower inflammation equals lower cancer risk. See flexibility and pelvic floor health. Stretch hips. Lower back mobility. Gentle yoga or light Pilates. Kegel exercises for bladder control. D. Daily movement. 10-15 minutes of walking after meals enhances insulin sensitivity. All of this works together as one powerful prevention system. The prostate protective diet. Food is not just fuel, it is chemistry. And for prostate health, the right food choices are more powerful than most supplements. Cruciferous vegetables, 41% lower risk. That includes broccoli, cauliflower, Brussels sprouts, kale, cabbage. Eating 3 or more servings per week reduces aggressive prostate cancer risk by 41%. This is due to sulforaphane, a compound that detoxifies cancer-triggering hormones. 2. Plant-based diet helps prevent aggressive cancer. Plant-based doesn't mean vegan. It means more plants, fewer processed meats. Studies show men with plant-heavy diets have lower inflammation and healthier testosterone metabolism. Your plate should lean toward vegetables, beans, lentils, whole grains, fruits, nuts and seeds, olive oil. 3. Omega-3 fats, 40% lower risk. Omega-3 reduces inflammation and improves cellular function. Sources include salmon, sardines, mackerel, walnuts, flaxseed, chia. High omega-3 levels are linked to 40% lower risk of fatal prostate cancer. 4. Tomatoes and lycopene. Cooked tomatoes are one of the most powerful prostate foods. Tomato sauce, tomato paste, roasted tomatoes all dramatically increase lycopene absorption. Lycopene reduces inflammation and slows abnormal prostate cell growth. 5. Foods that increase risk. Avoid or reduce processed meats, high dairy intake, heavy alcohol, high sugar diets, fried foods, excessive red meat. These increase inflammation or insulin, both harmful to prostate cells. 6. A full-day meal plan for men over 60. Breakfast: oatmeal with walnuts, chia, blueberries, green tea. Lunch: salmon salad with broccoli and spinach, olive oil dressing. Snack: mixed nuts or pumpkin seeds. Fruit. Dinner: lentil stew, roasted tomatoes, steamed vegetables. Evening: herbal tea, mint, green tea, or ginger. This plan is anti-inflammatory, prostate protective, and heart healthy. 4. Supplements: what works and what does. Many men waste money on ineffective prostate supplements. Let's break down the truth. Supplements that do not work. 1. Saw Palmetto. Despite being popular, it consistently shows no improvement in prostate health. 2. Vitamin E. High doses actually increase prostate cancer risk. 3. Selenium. Does not prevent cancer and in high doses can be harmful. Supplements that do work. 1. Vitamin D. Low vitamin D is linked to higher aggressive cancer risk. Recommended 1,000–2,000 IU daily if deficient. 2. Omega-3 supplements. A great option for men who don't eat fish. Recommended 1,000 mg EPA plus DHA daily. 3. Lycopene. Found in cooked tomatoes, also available in supplements. Recommended 10–15 mg daily. 4. Zinc and magnesium. Helps regulate testosterone balance and supports prostate tissue health. 5. Turmeric, curcumin. Anti-inflammatory, supports prostate cell health, beneficial for BPH symptoms. Optional but effective. 5. Lifestyle habits for daily prostate protection. 1. Don't hold your urine. This increases pressure and worsens enlargement. 2. Maintain a healthy waist size. Visceral belly fat increases aggressive cancer risk. 3. Manage stress. Chronic stress increases inflammation and hormonal imbalance. 4. Drink enough water. Dehydration irritates the prostate and bladder. 5. Prioritize sleep. Less than 6 hours per night raises cancer risk due to increased inflammation. 6. Limit alcohol. Alcohol raises estrogen and increases inflammation. 7. Sex and ejaculation frequency. Regular ejaculation 2-4 times per week is linked to reduced cancer risk due to prostate fluid turnover. 6. Screening guidelines for men over 60. Early detection is the difference between a small problem and a life-changing diagnosis. Here, what doctors recommend. 1. PSA test every 1-2 years. After age 60, track PSA changes, not just levels. 2. Digital rectal exam. Recommended if PSA rises, symptoms appear, there is a family history. 3. MRI imaging. If PSA changes slightly, an MRI is more accurate than biopsy alone. 4. Watch for warning signs. Weak urine flow. Getting up at night. Blood in urine or semen. Pelvic pain. Frequent urination. If you notice these, test early. Conclusion. Men over 60 face a higher risk, but also a higher opportunity. Exercise, diet, supplements, lifestyle habits, early detection. These are not small changes. They are powerful tools that can lower aggressive prostate cancer risk by 30–50%. Your prostate health is not predetermined. You have control. And today, you now have the blueprint. Stay strong, stay informed, and take care of your health starting now.